Hello everybody, this is Dr. Brad. I'm a Burlington chiropractor at Life Chiropractic Center, and today we're going to take a closer look at how I adjust infants. And what I'm doing here is I am placing the baby into a pregnancy pillow, which serves as a nice soft cradle for doing chiropractic adjustments. So what I do is start by doing some pre-checks so I know if the infant needs an adjustment and where. And my most valuable pre-check is the leg length check. So what I do is I stretch the legs out, and if one leg is tight and pulls up short, that means that there is a spinal misalignment or subluxation in the upper neck on the same side that the leg is short. And in this instance here, baby Gordon has a short right leg. Now my next pre-check is to have baby grab my thumbs and I gently lift him. And what I'm looking for here is that his head follows his body and that we do not see any head lag or his head is tilting to one side or the other. And this is also a good way for me to assess his grip strength. And if we see head lag or his head is falling to one side or the other, this is also an indication of subluxation or spinal misalignment in the neck. And it's interesting to note that after the 3 or 4 month mark, we should not notice any head lag. And if we do, there is a strong correlation with attention deficit and hyperactivity disorder. My next pre-check, I will lie him back down and I will check his hips for proper flexibility. Now we are ready to proceed with adjustment, and the instrument you see in my hand is an activator. And as I squeeze the activator, it gives a very gentle impulse, and we're going to start with an adjustment at his upper cervical spine or his neck. And I give 2 or 3 clicks of the activator to correct that spinal misalignment. Then I will assess the leg lengths again to see how much has changed. We're not quite there yet. I reach around behind and with my fingertips I'll check his thoracic spine and his lumbar spine for any spinal misalignments. And I will make that correction with a gentle impulse of my fingers. And finally, I'll have him sit on my lap, and I'm going to adjust both his sacroiliac joints, which, as you remember, are part of posture quadrant number 3, and posture quadrant number 3 is critical for stabilization of the spine. So I do a couple of gentle impulses on each sacroiliac joint, as you can see. Post-check, we place baby back into the pillow, and I'm looking to see that the legs are easy and they are now the same length. So our task is complete. He's in good spinal alignment. And good spinal alignment means good posture, and good posture means that his brain is effectively communicating with his body through his spinal cord and nerve system, and ultimately his health potential now is at a high level. So as you can see, chiropractic adjustments on infants is a very gentle and very easy procedure. So if you have any questions on this topic or any other health concerns that you may have or your family may have, please give me a call. Remember that consultations in our office are always free of charge. Family appointments are always available because spinal problems and subluxations do tend to run in families. We have office hours on Mondays, Wednesdays, Thursdays, and most Saturday mornings. And our phone number here in Burlington is 905-335-5433. And we'll talk to you again next week.